Here. I am a registered nurse that has been practicing for over 13 years. I currently function in this clinical setting as a nurse educator. Today, I'm going to open up my first official YouTube post um, by going over peripheral venous disease versus peripheral arterial disease, which is a disease that you will probably see within maybe your third semester of nursing, depending on what program you're in. So, peripheral venous disease or PAD versus peripheral arterial disease. These are two vascular conditions that affect the extremities, primarily the lower extremities. Each have different pathophysiology. They each have different signs and symptoms, but we're going to briefly discuss each condition. Okay, so the primary cause of PVD or peripheral venous disease is a valve incompetence in the vein, which is venostasis. In peripheral arterial disease, we have atherosclerosis, which is pretty much a narrowing of the arteries. How circulation is affected with PVD, the blood return to the heart is affected. So blood coming from the outer extremities to the heart, it's going to be affected, and blood flow away from the heart. In PAD, the blood flow away from the heart is affected. So your oxygenated blood has a difficulty leaving the heart and going to the extremities. Pain. When PVD, pain is aching, cramping, relieved by elevation. And PAD, pain is intermittent claudication or pain that is caused with walking. It's usually relieved by rest. Skin color changes. With PVD, you're going to have a reddish brownish skin coloration or cyanotic when the legs are dependent, which means when the legs are lying, not elevated, but when they're flat on the ground. And then the PAD, you will have your lower extremities will be pale when they're elevated, or they will have a dusky red coloring when they're dependent. Temperature. In PVD, the skin temperature is going to be normal. In PAD, it's going to be cool to touch. So that's the difference. Edema. With PVD, it's present usually in the lower legs, but in PAD, it's usually absent or very mild. You have skin changes with PVD. You're going to have thick, leathery, scaly skin, or brownish pigmentation, as I already stated before. And PAD is going to be thin, shiny. You are going to see like hair loss, and then the patient's nails would be brittle. Also, characteristics: if they have ulcer formations with PVD, the ulcers will be wet. They will have irregular borders, and they're usually going to be in the medial aspect of the ankle. In PAD, the ulcers will look dry, punched out, and you'll find them present in the toes, the feet, and lateral ankle. Pulses. With PVD, you usually have pulses. The pulses are usually present, but in PAD, the pulses are often diminished or absent. Elevation effect. In PVD, elevation is usually improved. So if you elevated your feet, the symptoms usually improve, so you're going to have a decrease in pain. If you elevated feet with PAD, the symptoms also often worsen, which means you're going to have an increase in pain. Treatment goals. With PVD, the treatment goal is to improve venous return and reduce edema. In PAD, the treatment goal is to improve arterial perfusion. And it's important for both because you want the blood going back to the heart to get the oxygen that it needs in PVD. In PAD, you want the oxygenated blood to be able to circulate to the outer, away from the body. Common treatments for PVD is compression therapy, leg elevation, and wound care. With PAD, you're going to use exercise, antiplatelets, statins, and revascularization. Risk factors for PVD are as prolonged standing, pregnancy, obesity, and a history of DVTs. In PAD, the risk factors for PAD are individuals who smoke, have a history of diabetes, hypertension, and hyperlipidemia. A nursing tip for remembering PVD, which is the venous, and PAD, the arterial, is that with venous, the valves are weak, so you're going to elevate the feet. And arterial, a way is blocked, so you're going to dangle the legs. This is my thank you for watching. Please like, subscribe, leave any comments on the at the bottom of this post if you come across it. Thank you for watching.